39% of NHS trusts were in deficit 3 months ago. 47% of NHS trusts are in deficit now. How can that be an improvement? How can you be on track? This is a short-term fix. You're ratcheting down deficits to save your political skin.
That is an absolute insult to thousands of NHS staff across the country.
I'm talking to you, not to them.
And I am saying to you that what you are saying is an absolute insult to the NHS staff who have worked their socks off this year to make difficult decisions.
Hold on. Let me tell you about this member of the NHS. Let me tell you about a guy who's been a doctor in North Yorkshire for almost 3 decades, who received this letter from his primary care trust telling him that he had to suspend services for 3 months, varicose veins, wisdom teeth, joint injections, carpal tunnel procedures.
I completely understand his frustration and his patient's frustration. But just remember...
So how am I insulting him?
There has been overspending in the NHS, in parts of the NHS, for virtually the whole of the last 60 years. How was it dealt with in the past? By simply letting the waiting lists go up. What used to happen when the NHS ran out of money or threatened to run out of money, 2 or 3 months before the end of the financial year? They simply stopped operations and let the waiting lists go up.
And now you have created a situation where there are, do you admit there are minimum waiting times? Not maximum waiting times. There are minimum waiting times to try and end a deficit so you can keep your job.
This has got nothing to do with me keeping my job. That is what's so insulting.
On cancer, there isn't a target for post-operative radiotherapy, as you know, yet leading cancer clinicians, oncologists that we've spoke to are genuinely concerned about post-operative radiotherapy and the waits that we've seen. We found at least 2 centres where 3/4 of people are waiting over 28 days. And this at a time when the money is going to start to slow down.
There is a worldwide shortage of radiologists and radiotherapists.
We've trained hundreds that haven't got jobs because there isn't the money, Secretary of State.
And this issue of needing more money for particularly post-operative radiotherapy and needing to bring into jobs more of the people we've trained or can recruit from elsewhere underlines the point that what we have to do is ensure that the NHS everywhere is as efficient as it possibly can be, is giving the best possible value for every penny that the taxpayer is putting in.
I mean, if you just look back since 1997, firstly you abolished GP fund holding, you dismantled the internal market, and then you reinvented the market that, again, you'd abolished in 1997.
Well, I know people...
It's very circular, and it's a very expensive circular journey that this government has been on in terms of its healthcare reforms. You must acknowledge that, Secretary of State.
Well, I know that people get frustrated by lots of organisational change, and I have a great deal of sympathy with that. It has not been a circular journey, because what has happened is that we've needed different kinds of structures at different stages on the journey.
There is some circularity, Secretary of State, please. Every health academic in the country says so.
Well, with hindsight, I would have loved to be able to get to practice commissioning faster than we have done. And I think it is an absolutely fair criticism that we didn't put enough stress on really good commissioning early enough.
So you stand by your statement that 2006 was the best year ever for the NHS, despite growing deficits, despite protests by nurses?
From the point of view of patients, more people are being treated faster and better than ever before. More people's lives are being saved than ever before. Of course it has been a difficult year, particularly for staff, as we sort out the overspending in a minority of organisations, but very serious in some of those organisations. That's affected the whole service. But what is now clear is we are absolutely on track.